We are back, and we are joined by State Health and Human Service Secretary Dr. Mandy Cohen. Remember, you can text your questions. The number is at the bottom of your screen, and we will leave that up. This first question says, with such a shortage of vaccine, why can't the so-called recipe for the vaccine be given to other drug manufacturers?
What a great question, and it is very frustrating that supply of the vaccine is very low, and we are limited by what is coming from the federal government to the state of North Carolina. And I know the Biden administration is looking at the Defense Production Act, which allows them to use some of those tools to say, hey, why isn't everyone manufacturing vaccine and sort of giving the recipe, if you will, to others? It was talked about as recently as this morning on how they can do that. Now, those still takes weeks and months to turn those kinds of things on and get production lines going. But we know we're going to be vaccinating. This is a marathon, not a sprint. And so I think folks are looking at those kinds of solutions. Unfortunately, that's a federal decision. It's not something here, unfortunately, in North Carolina that we have a lot of control over. We just want to make sure that the vaccine we get out quickly and we get it out equitably.
Speaking of which, this next text question says, when do you expect more doses to become available?
Yeah, great question. Supply is incredibly limited right now, but we're getting a little bit more each and every week. Over the past 3 weeks, we've gotten about 5% more each and every week. So that's a good sign that there's more supply, but still, even with just 5% more each week is
Okay, so we're having a little bit of technical difficulty there. I'm seeing that her shot is frozen there. What I do want to do is, while we work on this and we seem to get that up and running, I want to give you that hotline number one more time so that you have that hotline number. She mentioned it. She read off the hotline number. This is one of those places that you can call and get your questions answered. But this is not a place that you can call to get an appointment. This is simply a number for you to call and have some of your questions answered, or to find out where is the closest place for you to be able to get your vaccine. And that number is 1-888-675-4567. Again, 1-888-675-4567. The other thing we want to go over is also something that we touched on briefly in that first segment, which is the email that you may be getting from the Department of Health and Human Services that talks about a portal. And the reason why you would be getting this specific email is because you have an appointment, and they are trying to just cut down on the time that it takes for you to get all of your information into the system. All right, with that said, it seems that we have all of our technical difficulties figured out, maybe. I see Dr. Cohen here. Let's see.
Sorry about that.
No worries. It's okay. It happens. All right, let's continue on with the questions. This person says, should you get the COVID shot if you do not have a normal immune system?
Oh, great question. So as I was mentioning before, there are almost zero contraindications, or meaning reasons to not get the vaccine. Again, I'd always talk about it with your doctor, with your healthcare provider, but we are encouraging everyone to get the vaccine. Even if you have had COVID before, you want to get the vaccine. Even if your immune system is weakened for whatever reason, you want to get the vaccine. So there's almost no medical reasons that folks are saying not to get the vaccine. I will say, for those women who are actively pregnant, that is a conversation you want to have. But again, no data to show that there's any concern there, but a conversation you may want to have with your obstetrician before getting the vaccine. But again, we're recommending it for everybody.
This person is asking, when the state moves on to the next group for vaccines, can people who are 65 and older still try to set an appointment if they miss their group setting?
Great question. We don't close groups, we do add. So those 65 and up will still be able to get vaccine from now until we keep vaccinating. So you won't lose your turn by us moving on, but then there'll be more folks in the queue and being interested in getting it. And so you will have, frontline essential workers who are going to be making appointments at the same time, which is why we try to give priority to those who are 65 and up first, but you won't be locked out going forward.
Okay. This person is asking, what physically happens if you're unable to get your second vaccination?
Well, I would say we very much recommend you getting it the way these vaccines were intended, which is if you get the Pfizer vaccine, you want to get it 21 days after your first, or as close to it as possible. And for Moderna, 28 days after your first. So as close as possible is really what is recommended. Now, if you go past it, it is okay. You do not need to start over. Whenever you come back for your second shot, you can get that second shot and go on. But I would recommend everyone doing as close as possible, because again, we want our immune system to be as strong as possible from getting these vaccines, and that's what your second dose does. It helps your immune system get even stronger, make those antibodies that fight off this virus if you should come into contact with it.
Okay, we are allowing you to go one-on-one with Dr. Mandy Cohen. We're going to take a quick break. We'll be back for our last segment.